The Ministry of Health and Wellness launched its Jamaica Salt Consumption Knowledge, Attitude and Practices Study, or Salt KAP study, on Tuesday. The University of the West Indies and the National Health Fund will be working with the Health Ministry to complete the research. The findings will be used to establish programs in an effort to meet the World Health Organization's recommendations of less than 5 grams of salt per day for adults. Melvin Pennant has that story.
Overconsumption of salt or sodium contribute to high blood pressure, stroke, heart and kidney disease. Director of the Health Protection Branch at the Health Ministry, Dr. Simone Spence, says high blood pressure affects 1 in 3 Jamaicans, and another third is pre-hypertensive.
1 in 10 Jamaicans consume excess salt by adding salt at the table or frequent consumption of salty sauces or high sodium processed foods. The problem is not just salt added to food during cooking or at the table. A significant amount of sodium comes from ready-made meals and prepared foods, including processed meats, breakfast cereals, and snack foods. As a part of the NCD agenda, the ministry has undertaken several initiatives to focus the population on adopting a healthy lifestyle and taking proactive steps to improving their health.
Dr. Spence says an important aspect of addressing health issues in a population is through research.
This study, therefore, will help to determine the knowledge, attitude, and practices of our population as it relates to salt intake and strengthen the implementation of strategies to reduce sodium intake. Given that the entire population is at risk of NCDs, given the significant impact and the burden of NCDs, it's imperative that there is sustained action to mitigate the effects of salt consumption.
For his part, Minister of Health and Wellness, Dr. Christopher Thornton, notes that the study is part of the ministry's efforts to inform consumers on healthy lifestyle choices.
$1.4 billion Jamaican dollars goes to support Jamaicans with hypertension, and that's a big amount. What if we got Jamaicans to change their lifestyle and so not needing that kind of payout? Then the NHF would be more viable for starters. We probably would pay less taxes to secure our own health treatment, and of course the longevity and quality of life would be enhanced. This, to my mind, is the substance of the argument today why studies of this sort are necessary and why we cannot pull back from our advocacy around nudging Jamaicans to improving lifestyle, because frankly speaking, it acts in their best interests.
During the study, researchers will observe spot urine analysis, sodium content in packaged foods, and salt content of food sold in restaurants. In addition, there will be a national survey of 1,200 participants to evaluate knowledge about salt intake and health. Melvin Pennant, PBCJ News.